I think it's fair to say that there's a certain narrative regarding costs of healthcare in the United States. It goes like this. The US spends more on healthcare than any other nation and gets less for it. Is that really true? Moreover, how do we even compare costs between nations? Well, given that around 25% of Medicare expenditures are accrued in the last year of life, researchers from the University of Pennsylvania examined how 7 different countries, all large Western democracies, including the US, treat individuals who died with cancer. Using national registries in each of these countries, Zeke Emanuel and colleagues were able to look at questions like what percentage of individuals died in the hospital, and importantly, how much money did each country spend on them. These types of studies can be difficult to interpret, so I'll give you the party line first and then some criticisms. First off, the good news. The US had lower rates of death in the hospital than any of the 6 other countries at 22%. Compare that to 52% in Canada. That 22% figure is way down from the rates in the 1970s, where more than 70% of individuals with cancer in the US died in the hospital. What about costs? Well, the standard narrative didn't hold up that well. In the last 6 months of life, the average American with cancer accrued around $27,000 worth of hospital costs. That's a lot more than those in the Netherlands, $13,000, but pretty similar to those in Canada and Germany. I wouldn't be surprised if we see certain press outlets or perish the thought politicians crowing about how American healthcare costs seem pretty manageable. But here are some things to consider. First, this study only examined cancer patients. What's more, they only examined cancer patients who died. This says nothing about the myriad other costs our highly medicalized society accrues on the day-to-day. Second, the study looked only at inpatient hospital costs. Americans spend less time in the hospital at the end of life thanks to a fairly robust nursing facility and hospice system. None of those costs were included. Third, in the US, physician fees are billed separately from hospital fees. Not so in the other 6 countries, and physician fees were not included in the US calculus. Finally, a bit of a technical issue. How do you convert from, say, euros to dollars in a study like this? The intuitive answer would be to use some average exchange rate over the time period studied. The authors actually used the health-specific purchasing power parity conversion rate. That's a mouthful, but basically it's a number that reflects the relative costs of purchasing a market basket of health-related goods in each country and adjusts for that. In other words, countries where healthcare is cheaper relative to the true exchange rate would have their end-of-life costs adjusted upwards, making them look more expensive. I suspect this could move the final numbers by as much as 20% in either direction. So there you go. We're doing okay here in the US, at least when it comes to caring for patients with cancer. But remember that complacency can be costly. For MedPage Today, I'm Perry Wilson.